Welcome to EyeCan, a podcast about ophthalmology through a uniquely Canadian lens with Dr. Setareh Ziai and myself, Dr. Guillermo Rocha.
The EyeCan Podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's ophthalmologists.
We'll share our experiences as ophthalmologists today and tackle some of the challenges we face as healthcare providers. Are you ready, Setareh?
Let's do it, Guillermo.
Let's do it, Setareh.
On this episode of EyeCan, we are joined by Dr. Cecilia Lee, Chlorfine Family Associate Professor of Ophthalmology and Director of Clinical Research at the University of Washington in Seattle. Dr. Lee's research focus includes bioinformatics, deep learning, and clinical epidemiology. Recent published work includes clinical outcomes research in age-related macular degeneration and diabetic retinopathy. In her new paper, published in JAMA Internal Medicine, Dr. Lee and her colleagues report exciting findings related to the association between cataract surgery and dementia risk. That will be the focus of today's conversation. Welcome to the EyeCan Podcast, Dr. Lee.
Hello, thank you. Thank you so much for the invitation and then having me in the podcast.
Dr. Lee, it's been amazing when we saw the title of your article, and it's been sort of popping up in different media and different feeds. You report very exciting findings related to the association between cataract surgery and dementia risk in your study. What prompted you to research this, and what is the background of this study? We have certainly felt certain things when we see our patients, but you now kind of fundamentally establish this association. So what can you tell us about it?
Thank you. So I think it goes back to our lab's research that focuses on the big data and clinical epidemiology. And nowadays, because we are bombarded by large set of medical data, such as electronic medical records and retina imaging, it has become much easier to really study different specialties and making novel connections between the eye and something else, such as the brain. And so I was fortunate to be involved in the study called Adult Ages in Thought study, or ACT study, in collaboration with Paul Crane at University of Washington and Eric Larson at Kaiser Permanente Washington. And they had an exciting study going on since 1994. And then that's where we were able to really ask, can we take advantage of this big data set, an amazing data set, to see whether there's any connection between the aging eyes and the aging brain. Our first study was really focused on looking at the basic questions, such as, is there an association between age-related macular degeneration, diabetic retinopathy, and glaucoma with the development of Alzheimer's disease? And to our surprise, there were significantly higher risk of developing Alzheimer's disease, almost 50 to 60% in these populations. So that really led to our question about, well, what about cataract? And if we were to intervene and improve the cataract by doing cataract surgery, does that have any impact on future development of dementia?
That's an amazing link and an amazing way to kind of progress your research. So what did you find? So
we found that based on a record of over 3,000 participants, we found that people of similar caliber of health, people who underwent cataract surgery were approximately 30% less likely to develop dementia compared to the people who did not undergo cataract surgery. And we found similar risk for Alzheimer's disease development as well.
Yeah, those are incredibly interesting findings. 30% reduction in the risk of dementia. I assume that you corrected for a lot of confounders. I mean, I've read your article, and of course, there may be people who may question certain things. So how did you account for certain biases and the different confounders that you addressed in your study?
Yeah, so if I am being quite honest, I think I was also questioning whether the results were too good to be true. And then so actually we did a lot of secondary analysis to kind of prove it wrong and to find potentially different results. And so, and I agree with the concerns that, especially in a setting like this, that this is an observational study using the electronic medical records data, and then just the research study population, unlike RCT. There's a concern about, well, maybe people who were able to have cataract surgery were just healthier at baseline so that they could afford to have a cataract surgery, as opposed to people who didn't. So the first bias that we were concerned about was the healthy patient bias, so that we control for many, many confounders that could explain why somebody might have been sicker or why somebody would not likely to pursue cataract surgery. So not only did we control for all the past medical history, such as hypertension, diabetes, or history that they had a stroke, etc., but also we control for how much were they likely to exercise per week? Did they ever report any trouble with the activities of daily life? And then even what is their attitude, or what is their health utilization records like? For instance, are you likely to have seen your primary care doctor many, many times the year prior to cataract surgery, whatnot? And we found, we were surprised to find that we still found about 30% reduced association. And I know you might ask about this glaucoma surgery issue, because that was another control that we used. So again, even though we were able to control for all the confounders, we still weren't sure whether this was true or not. So then we asked, well, it could be that people who are able to afford to have outpatient cataract surgery and some eye surgery, they could be different. So then we picked the glaucoma surgery as a potential sensitivity or control condition, since we know that glaucoma surgery is an outpatient surgery, such as just like cataract surgery. But then the purpose of glaucoma surgery is not really to improve per se, it's really to stop the progression of the glaucoma, and it really shouldn't improve the visual function and whatnot after the surgery. And when we looked at whether the glaucoma surgery was associated with increased or lower risk of developing dementia, we found no association. So that kind of gave us more reassurance that the result that we found are likely more specific to cataract surgery, rather than the fact that somebody was healthy enough to undergo any type of intraocular surgery.
Yeah, excellent. Thank you. Thank you.
That's so interesting, Dr. Lee, and such a significant number. I think it will have all of us thinking about this when we see our patients and deciding on when to book them. I'm sure you've thought about this a lot since you've published it. What do you guys think are some of the potential mechanisms that might contribute to this association?
I think the obvious mechanism that everybody will agree on, and our patients agree on, is that their vision and visual function likely improves dramatically after cataract surgery, so that once your vision is better, then they're more likely to go out more, become more social, more engaged with the world. And so less depression, more exercise, more engaging socially, then those risk factors have already been shown to be protective against dementia development. I think another hypothesis, again, better vision, better visual stimuli, that translates into better brain stimuli, better neuronal connections, so healthier brain and therefore less dementia. I think the last hypothesis might be even something that I'm very interested in, and is based on, I'm sure many of us have talked to patients who come in the day after cataract surgery, and they say, the world is so much bluer. They recognize that this yellow tint has been lifted, and then things just look a lot bluer than usual or than what they are used to. And so it's the potential role of the intrinsically photosensitive retinal ganglion cell, or iPRGC. iPRGC cells, as you know, they are they have an important role in regulating our sleep cycle, circadian rhythm, and also has been associated with cognitive function, and then cognitive function. So we thought that because of this blue light being so, I take that back, because of this yellow tint of the cataract is so good at blocking blue light. And then once we take the cataract out, then we have a lot more blue light coming in, and maybe those iPRGC cells are more stimulated, and therefore they could be playing another role in terms of dementia development. So those are all hypotheses. Obviously, our study was not meant to study any causations and whatnot. So, but I think it'll be really important for us to do further studies so that we can understand better the mechanisms.
Yeah, and that brings me to my next question. What are you working on? What are you working on now? What is the next step in, bringing about some clarity about where this comes from and how we can target patients at the right time before they start going into that tunnel of dementia? I'm sure you're working on some new ideas and how to test some of these hypotheses. Do you want to tell us a little bit about that?
So I think until we really know the mechanisms, it would be really hard, when to recommend cataract surgery, the optimal cataract surgery time, other than the fact that when the ophthalmologists have already recommended cataract surgery, then, it probably won't hurt to go ahead and get that done. So that's one. Number two, yes, we're very interested in the mechanistic part, and then also what else we can take advantage of to have better understanding, such as taking advantage of state-of-the-art eye imaging. So we have such beautiful technology now to be able to do non-invasive retinal imaging with OCT, OCTA. And I think there are a lot of hidden information there that we just have not been able to realize. So I think this marriage between the big data and AI or machine learning having this spark in our ophthalmology field, just because we have such a large access to big data and also retinal imaging. So I think as the research progresses that involves both big data and machine learning approaches, I am hopeful that it will really provide us novel insights in terms of novel connections between features and features that are associated with cognitive function. Not only that, but then potentially other ideas on what the mechanism might be that could explain the connection between the eyes and the brain.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
Hi, I'm Dr. Claire Chan. I'm an assistant professor of ophthalmology at the University of Toronto, and I listen to the EyeCan Podcast.
Dr. Lee, I'd like to shift gears a little bit. And we have the science, we have an amazing study that you did. And I'm sort of just thinking, well, in a system like ours here in Canada, compared to a system like yours in the States, and there's different variations on the theme, I guess, even on both sides of the border, we're constantly fighting for surgical time. And, we've seen studies that reflect that cataract surgery reduces the risk of hip fractures and other issues, depression as well. And so with the backlog that we currently have in Canada and the way the resources are almost counted, do you see any impact on the way we prioritize procedures? Perhaps you're more familiar, obviously, with the way in the States, but have you considered how this would impact places with a different healthcare system, such as ours, or such as the more socialized or mixed hybrid systems?
That's a great question. And I would love it if we could see the difference. And again, I think, we would still need some validation studies and, hopefully replication in other cohorts. And I would love that if, we can take advantage of clinical data from other countries such as Canada or even UK. So that's one. And second, yes, I mean, we would love to see whether this finding really translates into difference in the practice. I know a recent paper from Emily Chu's group from NEI has also shown that cataract surgery is not associated with worsening AMD. I know at some point that was, definitely concerning. So I think there are more and more papers coming out regarding the potential benefits of cataract surgery, and as you mentioned, the benefits of other systems such as low reduced hip fracture rate or depression. Those are all critical. So I would love to be part of this this potential change. I'm not sure what we can all do with as ophthalmologists, but I think I agree with you. Try to take better care of our patients, and then also try to deliver the care at the optimal rate is critical.
It's huge advocacy, I think, for them if we look down the line.
Well, Dr. Lee, I think this is groundbreaking. I look forward to seeing what future studies teach us about what the mechanisms are and how we can help our patients at the right time. Based on your publication. Before we let you go, we would love to ask you some other questions in a different domain. We like to ask our guests what they do in their downtime, if there's any favorite books or podcasts that you listen to, or anything else you'd like to share with our audience. Thank you.
So we have a soon-to-be 4-year-old daughter who, she's a Valentine's Day baby, so she's turning 4 on Monday. And I would say she's a monster. So she really takes over our household and, whatever I'm trying to do. And I don't know. So I lead a lab, a competition ophthalmology lab with my husband, who's also an ophthalmologist. He's a retina surgeon and he does the AI work. So there is a lot of talk, a lot of, dinner conversations are a lot in ophthalmology and research. But ever since our daughter came out or came into our family, she has been the source of our life. And then great. We also have a 16-year-old Shih Tzu mixed dog cool. Who is bilaterally blind. So he's an interesting character as well. Not from cataracts, I assume.
Yeah.
The one is from cataract, and then one is from total retinal detachment. Okay. And yes, so we try to actually sign him up for cataract surgery, and then we found out that he has large murmur, and then they asked that he needs an echo and needs to be medically cleared, and all the things that we asked. And we just decided, maybe
he needs a CAT scan.
But he's not demented. He's pretty sharp.
That's good. That's good.
That's great. Thank you very much, Dr. Lee. It was such a pleasure to have you on our podcast, and we look forward to seeing more from you and your lab.
It was an honor to be here. Thank you so much for having me.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
The EyeCan Podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's ophthalmologists.
Thank you to the Canadian Ophthalmological Society.
The EyeCan Podcast is written and directed by Kim Tytler and produced by John Allaire from Allaire Strategic Works.